To fall, it's crucial to remember that lurking just outside are disease-carrying bugs and birds that can ruin your family's fall fun. The College of American Pathologists is stepping into the spotlight to educate the public about protecting themselves from disease-carrying insects and birds because knowledge is the best defense. Here to discuss is Dr. Bobby Pritt, chair of the College of American Pathologists Council on Scientific Affairs. So what do we need to be on the lookout for, and how high is the danger of disease-carrying insects and birds?
By insects, we really are talking about mosquitoes and ticks. And in Florida, mosquitoes are definitely an issue to be concerned about. Mosquitoes transmit a lot of harmful viruses, including West Nile virus, Eastern equine encephalitis, and others. Ticks, of course, transmit Lyme disease. That makes them very important. So we want to be aware of what's in our area and prevent bites from those two types of bugs. Now, when we talk about birds, we're really talking about highly pathogenic avian influenza or bird flu. There have been a lot of cases and outbreaks in domestic poultry and dairy cows. And so another area that we just need to be familiar with. And you want to prevent mosquito bites and tick bites and other arthropod bites. Prevention is really key for these diseases. So part of that could be avoiding times when mosquitoes are out and actively biting. That would be primarily dawn and dusk. But if you are going outdoors, make sure that you wear a good repellent, something that contains 30% DEET or another repellent that's active against mosquitoes and ticks. Also covering up, and so you don't have exposed skin, and making sure you check yourself for ticks when you come indoors. Now, in regards to protecting yourself against avian influenza, the risk is much lower, but I'd still like to mention you want to avoid infected poultry and infected dairy cows. If you do become ill, you really want to see your physician right away. You don't want to wait because some diseases will get worse over time if they're not treated promptly. And when you do see your healthcare provider, be sure to tell them any potential exposures that you've had. For example, if you were outdoors and you had a lot of mosquito bites, or if you recently visited a dairy farm, that's important information to share. And then that will help the physician order the correct tests, such as those overseen by a pathologist, so that your physician can get the information they need to provide the right care for you. A great resource is from the Centers for Disease Control and Prevention, that's cdc.gov. Yourpathologist.org is another excellent resource that's provided by the College of American Pathologists. Both provide very trusted and reliable information.
We see